Triple-negative breast cancer, as we know, is an area of unmet need. It's a disease that unfortunately continues to be defined by what it lacks rather than by what it has or what drives the growth of that particular cancer. So over the last several years, we've seen a lot of work trying to characterize triple-negative breast cancer by those genomic drivers, and there have been several publications that have classified triple-negative breast cancer in different subgroups. Of this, we focused in our study in the Luminal androgen receptor subtype, which is a subtype of triple-negative breast cancer that is enriched for some non-estrogen hormone signals, particularly the androgen receptor signals. And there has been some suspicion over the years that this particular subtype of breast cancer has a different behavior than the traditionally defined triple-negative breast cancer, or the most common type of triple-negative breast cancer. So our group focused on trying to identify better ways of identifying these patients at the genomic level. So work by Krishna Kelari at Mayo and in collaboration with several other investigators and under the leadership of Matt Getz, we have developed a genetic signature that appears to identify very specifically the subtype that is driven more by the androgen receptor. And we try to determine how that compared with other ways of identifying it. So outside of doing genomic sequencing, in the clinic or in clinical trials, androgen receptor expression is typically used to identify this particular subtype. There have been 3 clinical trials, prospective clinical trials, evaluating androgen blocking medications that have used immunohistochemistry and a threshold of 10% for the androgen receptor to define this group. And we see that using that particular identification method, the activity of these drugs is very limited. So clearly we need better ways to identify these patients.